Hello, my name is Giselle and I'm the Senior Occupational Therapist at the Queensway Carleton Hospital. We will be demonstrating different options for bathroom safety that you may want to consider when you have suffered an injury, a recent surgery, or you are weak or deconditioned. Most toilets are too low for some of us after suffering a lower limb injury. I recommend that you measure the length from the floor to the back of your knee, then add 2 inches or 5 centimeters. This would be the approximate height that you would require to sit on your toilet. If you are not tall, you may be able to add height to your toilet by purchasing an adapted toilet seat at a plumbing store. When we go to stand up, it is easier to have something to push up from. If the toilet is at the correct height for you, or you are using the adapted toilet seat, you can add a toilet frame. If your toilet is too low, you may consider using a raised toilet seat with arms. It clamps onto your toilet. It may or may not fit on your toilet, depending on the shape of your bowl. You need to check this out and make sure it does not wobble. The disadvantage of using a raised toilet seat is that you cannot adjust the height and it might not meet your needs. If the seat is too high, it's more difficult to have a bowel movement. Also, men do not particularly like it as they find the hole too small. It is also a little more difficult to clean. Here at the Queensway Carleton, we do not recommend the raised toilet seat often. What we do recommend is the over toilet commode. It is height adjustable, easy to install by lifting the toilet seat and placing it over the toilet. You can get one with a splash guard. If you get up often at night to go to the bathroom or are too weak to walk to the bathroom, the over toilet commode can be used as a bedside commode by adding the bucket. We suggest that you place a plastic bag with paper towels to absorb the liquid in the bucket. Then in the morning, you take the bag out and put it in the garbage. Examples of types of injuries that you may want to consider using adaptive toilet devices may be a fractured ankle, a fractured hip, a total hip replacement, a total knee replacement, fractured arms and shoulder, a shoulder replacement, or if you are too weak after being sick. You can purchase and or rent some of these devices from a pharmacy or your local adaptive device vendor. To review, when you attempt to stand up, push through your arms straight up. If you are using a walker, do not pull on the walker to get yourself up as it will tip. If you have a shoulder replacement or a broken arm, you cannot put weight through your injured arm. Slide yourself forward, slide a foot forward, lean slightly forward, and push up with your uninjured arm. Getting washed and dressed takes more energy than walking down the hall. You need to pace yourself and manage your energy level. The best way to accomplish this is to sit. We recommend that you do not sit on the bottom of the tub. You may want to consider a tub transfer bench. Again, you adjust the height to be 2 inches above the back of your knee. The transfer bath bench is open on the same side of your shower head is. Wet skin on plastic is like a suction cup, so I would suggest a tea towel on the seat so that you can slide across. You back up, your hand reaches for the bench, sit on the bench, turn around, straighten your knee, slide across, and straighten out the other knee and slide across. If you have difficulties lifting your leg, you can use a towel under your foot to lift the leg up. To shower yourself, I would recommend a handheld shower head to make it easier. If you have restrictions and your hands cannot reach past your knees, you will not be able to turn on the taps. You will need to have someone to turn on the water for you. If you are alone, turn on the taps before you get in and get the correct temperature. Then you slide into the tub. You will use a reacher to pull the button up to get the shower going. To wash your feet, you may want to consider using a long handle sponge, or you can put a face cloth at the end of your reacher. You need to tuck the shower curtain under your bum. Otherwise, someone will need to mop the floor afterwards. To get out, you slide across, straighten your knee, slide across again, straighten out the other knee, and slide across. We recommend a rubber mat outside the tub and shower to reduce the risk of slipping. You can place a towel on the floor and use your reacher to dry your lower legs off. When you have staples, they may get wet for you to shower. They are made out of aluminum, so they will not rust. You will have an island dressing, also known as a strip dressing. Here at the Queensway Carleton Hospital, we use either a 10-inch or 12-inch long dressings. You can purchase the island dressings at a specialty pharmacy. Remove the island dressing when it is wet. You pat dry your incision, let it air dry a few minutes, and place a new dressing on. Once your staples are removed, you do not need to use an island dressing. You are considering installing grab bars. We recommend one at the entrance of the tub, one diagonally on the other side of the wall, and possibly one vertical one at the other back end of the tub. We suggest that the grab bars be textured so when your hand is wet, you have a better grip. You need to have the grab bars professionally installed. When having your grab bars installed, the middle of the bar should come to the height of your bent elbow. Some of you may have suction grab bars. We do not recommend them as they may slide down the wall. Also, do not hold on to your soap dish nor your towel rack as it may come off the wall and cause you to fall. Some of you may only have one grab bar on the back wall. I suggest you use your mobility device like a walker and step over to the side. Bend your knee behind you over the tub side and reach for your grab bar. Then lean on your walker and grab bar to get your other leg over the tub side. Another way to get in if you do not have grab bars is to use a tub clamp-on bar. You need to have good balance in order to be able to do this safely. You lean on the bar, bring your knee behind you, step in, then the other knee behind you over the tub side, and you are in. If possible, I recommend that you have a shower chair or stool to sit on in the tub while showering. This will help to conserve your energy. Ideally, if your shower chair can fit in your walk-in shower, that would be the best. Make sure it is at the appropriate height for you. If you have a built-in seat in the shower, often it is too low for you to sit on. You may want to consider increasing the height by adding some folded thick bath towels. I suggest placing a rubber mat outside of the shower to reduce the risk of slipping. I recommend that you sit to dry yourself off. You can sit on your shower chair or on your toilet. I hope that this video provided you with some suggestions on how to transfer yourself safely in the bathroom by using adaptive devices. In summary, you have to think of what is the safest way for you to go to the bathroom or shower yourself. You also need to keep in mind your energy level. Sitting and increasing the height of surfaces will help you to conserve your energy. It is recommended that you have a family member or a care provider in the home for the first time you take a shower. If you do not feel safe, consider having sponge baths until you gain some strength, balance, and endurance. If you have any questions, please talk to an occupational therapist or a physiotherapist.